you had fun up here, Jim, because you're first for this next one. All right, tell us about one Oklahoma family you've met on the campaign trail whose story changed how you think about health care, and what legislation are you going to file because of that experience?
I've told this story a number of places I've stopped. Early on in the campaign, I went to Pauls Valley, and I met with Democrats at a coffee shop. And one of them told me this story about a friend of theirs whose mother had a heart attack. And the woman bundled her mom up into the car and rushed over to the Pauls Valley Hospital, pulled in the parking lot, only to discover and remember that the hospital had closed last year. She was just in the habit of going there for any medical needs, but she'd forgotten that the cutbacks in Medicaid, the cutbacks by the big ugly bill, had closed that hospital. And it's now a rehab center where people go to, get back on their feet after they've had surgery. I thought to myself, that lady needed health care in her vicinity, in her locality, but she had to turn and drive about 30 minutes to Purcell. And when she pulled in the driveway at Purcell Hospital, her mother was dead. Nobody should die because of a closed hospital, because of the lack of accessible and affordable health care. I'm fortunate that I've got health insurance. If I need to go to the doctor, if I need to buy a prescription, I can do that. But many people are facing the decision, do I buy groceries this week or do I get my prescription filled? Yeah. And we've got to do something about that. The thing that we can do is to reverse the big ugly bill. They call it the big beautiful bill, but it's only beautiful for billionaires. Right. It's the big ugly bill because it gives tax breaks to the ultra wealthy and it takes away people's rights to health care and gives very little in return to them. We're seeing a great gap between the ultra wealthy and the regular everyday Americans, and we've got to close that gap through legislation. And senators can do that. We're working already, I can see even bipartisan action on affordable housing, and I'm glad that they're doing that. Elizabeth Warren, who's on the left, and Tim Scott, who's on the right, saw a common problem, and they worked on fixing it. And we can do that same thing with healthcare.
So something recently that just happened over this past weekend with a close friend of mine was that the system failed her child. Well, it was her stepchild, and the baby was brutally beaten by the biological mother's boyfriend ultimately, and they didn't arrest the mom, but they did arrest the boyfriend. And so while they've been fighting and fighting and fighting the system, the judges, they were just kept releasing the baby into the mother's care, even though the baby was having bruises and was being reported, that the baby ultimately ended up dying a couple of days ago. And so with that being said, I swore that I would advocate on behalf of Maria. And I want to say that we need to be strengthening our court systems. We need to make sure that kids that they're not going undetected, abuse systems, and also our rural healthcare systems aren't closing because of the mere fact that we don't have the funding because of the big beautiful bill. That's correct. But also they are our mandatory reporters. So if we don't have mandatory reporters out there where this child was being taken to the hospital in Edmond at the time and they didn't report what was going on, and I mean, at the end of the day, this could have been prevented, especially when it came to our court systems, it came to our healthcare systems, our mandatory reporters, but it also could have been prevented if someone was able, if we had the funding and we had enough social workers who were able to take care of these kids and we had foster homes. I want to bring in the resources to be able to save children at the end of the day because no child should die by the hands of an adult at all. And I think that that's very important for us to always speak on.